Hi, and welcome to our webinar, Communication for Everyone, Improve Language Abilities for Children. This webinar is about various communication disorders of children and how help from speech therapists, parents, and other caregivers in a child's life can be effective. Hi, my name is Ayana, and I am a nationally certified speech pathologist, elated to present on this subject. I have served children and adults by providing speech, language, and swallowing treatment for over 15 years. Children communicate in a variety of ways, including through oral expression, signing, and gesturing. When we look at language, we are looking at the vocabulary and words of that language, syntax, and grammar, as well as how an individual uses that language. At least 5% of children will present with speech delay. Most will resolve them by the time of formal schooling. However, if it persists, it can affect literacy, behavior, socialization, and academic achievement. There are different types of speech and language problems that affect children. One is called the speech and sounds disorders. It is a problem combining and producing speech sounds within words and sentences, and it diminishes the listener's ability to understand what a child is saying. If you are concerned that a child may have a speech disorder, you should get a speech and language evaluation. When we see that a child is not understanding and or using language in a way that we would expect for his or her age, this may be an example of a language delay. A language delay is when communication and understanding of words, combination of words, and the social use of words is behind normalized measures of vocabulary, word combinations, and socialization of typically developing children of a specific age range. Every child develops uniquely, and no child is the same or uses the exact same words at the exact same time. But if a parent, guardian, or a caregiver is concerned that a child is not speaking enough or does not appear to understand language as expected, they should seek an evaluation by a speech pathologist. A language disorder is a significant and persistent impairment in the learning and use of language. One of the main differences between a language disorder and a language delay is that with a language delay, there is an expectation that a child can catch up and get pretty close to the standardized norms of language for typically developing children. Whereas with the language disorder, typically this is an ongoing and persistent problem in how a child can develop or can acquire language. However, with intervention, many children are fine and can adapt and are able to use strategies for learning language. If you suspect that you have a child or know a child that is showing some difficulty with acquiring language, you should seek an evaluation by a speech language pathologist. Childhood apraxia of speech is a resulting impairment of speech due to mistakes of planning and programming movement of speech sounds. If you suspect that a child has difficulty speaking or using language, please seek an evaluation by a speech language pathologist. Stuttering is also called a fluency disorder because of the interruption and discoordination of speech sounds while talking. Most people recognize repetition of a word or part of a word as stuttering. However, there are many other symptoms of stuttering. If you suspect that a child is having difficulty fluently producing words in speech, please seek an evaluation by a speech pathologist. Loss of language due to brain injury is called aphasia. It is an impairment in the comprehension and expression of language abilities, including speech, reading, signing, writing, and understanding. Some or all of these abilities can be affected. If you suspect that a child has lost language, please seek an evaluation by a speech pathologist. Hearing loss. Children with hearing loss have difficulty talking. Get hearing screenings for your child from his or her pediatrician or school nurse. A hearing screening is a quick test to see how well a child or a person can hear different sounds. You either pass or fail the screening. When hearing loss is suspected, a full audiological evaluation from an audiologist can rule out if hearing loss may be contributing to speech and/or language impairment. One of the ways to build support around a child who may have a communication impairment is to find out what is happening with the child's communication. A speech pathologist can perform an evaluation and give you information about that. It can be a great relief to find out if, in fact, there is an issue with speech and language, and if so, what it is, and what are the interventions, strategies, and goals that can make things better. Dealing with a communication impairment is no walk in the park. It takes work, and sometimes it can be frustrating. Continue to develop an environment that adapts to the communication levels that are supportive of the child, but also the people in the life of the child. Thank you so much for listening to this webinar. I have enjoyed comprising it for you. Once again, my name is Ayana Webb. I'm a nationally certified speech pathologist and owner of Tip Top Speech. Go to the link below and sign up to hear about more of our webinars, offerings, and events here at Tip Top Speech. Have a great day.